Some people can fall into labor and within 3 hours, they have their babies. And that kind of labor is called precipitate labor. Hello everyone, if you're just joining me today, my name is Opeoluwa and I am a midwife. And I talk about everything related to pregnancy, childbirth and baby. Follow me, subscribe to my channel, like and comment and share my posts, and I promise you have a swell time. Trust me. Welcome back to my space. And so today we'll be discussing the types of labor and the signs of labor. Yeah, I know labor and pregnancy can be different for different women. Signs of labor, signs that your baby is about to come can be different for different people too. But then we have the signs, we have some of the documented signs that happen to majority of the people. And before I go to the signs of labor, I'll talk about the types of labor. Now we have the true labor, the false labor, and the precipitate labor. Now, you know that false labor that happens, false labor happens when it happens like about a week or 2 weeks before the actual delivery, before the actual labor starts, before the true labor starts. And then you just start feeling contractions. You feel like your baby is coming. Your bag of water may or may have not ruptured. You feel like you feel like your baby is coming. You can have this persistent abdominal pain, backache that feels like, oh, it's like your baby is coming. But then ultimately they don't lead to the dilation of your cervix. That means this mouth of the womb is not opening. That means it is false labor. So true labor is actually a rhythmic, a regular uterine contraction that is tightening, pains in the tummy, backache that ultimately leads to the opening of the mouth of the womb. That is the dilatation of the cervix. So that is true and false labor. And true labor happens when the baby is about to come. False labor happens 8 weeks or 2 weeks before the actual labor starts. So in true labor, you have tightening, you have regular contraction, you have regular painful contraction, and then your bag of water may break and all of that. And then, do you know about precipitate labor? A lot of people have gone through this, but they don't know what it is called. Precipitate labor actually lasts within 3 hours or less. That means it's just some people say, I just started feeling pain, no, and it's not even up to 30 minutes, it's not even up to 1 hour, and my baby came out. Yes, that is precipitate labor. Precipitate labor takes only 3 hours, less than 3 hours, from the beginning of the signs and symptoms to actually the expulsion of their baby. That's fascinating, isn't it? God is marvelous. So what are the signs of labor? Signs of true labor, we have contraction, also known as tightening, also known as painful abdominal pain. That is, you can feel the tightening and relaxation, that's contraction of uterus. That's called contraction. And then we have shoal. Shoal is very characteristic. Not all people see shoal, but it is actually very characteristic. So if you see shoal at the end of your pregnancy, then you know that, okay, baby is coming anytime soon. And what do I mean by shoal? Shoal is that mucus plug. It can be blood stained. It can be just like mucus that comes from the nose. Mucus, plain mucus mixed with blood, or just blood, minimal quantity. That is shoal. If it happens at the end of a pregnancy, like when you're after 37 weeks, and you see anything of such, then you should be moving to the hospital as quick as you can. So another sign of labor is this persistent backache. It's a sign that your baby is trying to navigate through the pelvic area just to find a way out. So you can have this persistent backache accompanied with the tightening, with the stomach ache. And that's a sign that yes, your baby may be coming out. And then breakage of water. Just like when you pierce through a bag of water, everything just come out, expel, and that is breakage of water. And that is a sign that the mucus plug has gone, and then that is how the water is able to come through. And that's a sign that your baby will be coming anytime soon. Another thing is nestling instinct. What do I mean by nestling instinct? Do you know that feeling for people that have had babies? That feeling like you just start feeling like, I want to arrange my house, I want to keep my baby's bed, I want to arrange the cot, I want to put flowers around, I want to arrange the room, I want to cook, I want to make everything in the house so neat and nice, I want to cook for the whole family, I want to cook and put in the fridge, I want to fetch water, I want to do all the chores, I want to do all the laundries. Those are nestling instincts. They are instincts that help you prepare for the delivery of the baby. their maternal instinct, their nestling maternal instinct that makes, okay, nestling, like, okay, my baby is coming anytime soon. Even though you are not aware of what you're doing, you just have the strong urge, and then you have the energy. There's this pump of energy into you that make you feel like you can do everything. Some people will lift very heavy things. Some people will lift heavy stuffs, heavy materials. They will carry this. They move things from one place to the other. They will keep the whole house arranged, keep the bed arranged, do the laundries, even the laundry that is not their own. Some people will do it. They go and knock on their neighbor's door. Please, can I do your laundry for you? It can be like that for some people. Some people will wash plates and wash plates and wash plates. I know somebody that even went to party to go and be washing plates because she just have this burst of energy and she feels like working. So that's the nestling instinct, and this can also be a sign of labor. Another sign of labor is vomiting and stooling. Now, this is very tricky. Diarrhea in pregnancy is bad. It is very bad. So as a matter of fact, if you have diarrhea in pregnancy, you should be reporting to your doctor. You should be reporting to your midwife because it is very bad. However, it could be a sign of labor. However, it is not documented. When you pass through, it could be actually because of what you have eaten or something. When you pass through, anything that can increase your intra-abdominal pressure. What do I mean by intra-abdominal pressure? That makes you strain your tummy like you want to poo. Anything that can increase pressure in your tummy can actually lead to the descent of the baby. That is why even vomiting at the end of pregnancy can actually lead to labor too. Because some people just find out that they just keep vomiting and vomiting. And the more you strain, the more pressure you apply to your tummy, the more pressure is applied to the baby to descend into the pelvic area. And the head of the baby, if the head of the baby meets with the cervix, there's this hormone that is produced. It can actually lead to dilatation of the cervix. So that's why we put the vomiting and so I will not use diarrhea. I call it stooling. So when you are stooling at the end of pregnancy and you are almost ready, you say that you are almost like you are your due date. Your due date is fast approaching. You are at the end of 37 weeks, and you keep vomiting and you keep going to the toilet. In one particular day, you should actually phone your midwife, see your midwife, see your doctor. They should actually get you checked because it can be the sign that your baby is coming. Now, labor and pregnancy is yours alone. Listen to your body. If you have any concerns, any reduced fetal movement, any concerns in pregnancy at all at the end of pregnancy, then you need to go to your hospital. If you feel uncomfortable about anything you feel about your body, about your baby, then you should be reporting to the hospital. Thank you very much for listening to me. If you have not subscribed to my channel, please subscribe to my channel. Follow me on Instagram at Sabi Midwife. On Facebook, on Instagram, on TikTok at Sabi Midwife. Thank you very much. Like, share, and comment. Make comments. If you have any other comment, anything to ask me, questions, put them in my comment section and I'll be with you there. I'll engage with you. Engage my post. Thank you very much. Bye.